Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one new case of COVID-19. The total number of cases is now 255. The total number of COVID-related deaths in Manitoba remains at 6. As of this morning, 7 individuals are hospitalized. Of that, 4 are in ICU. 150 individuals are listed as recovered. There are 99 active cases. Yesterday, 314 tests were completed at Chatham Provincial Lab, bringing our total to 20,319. As announced late last week, we've expanded our testing criteria. This criteria includes all symptomatic workers or volunteers at workplaces that have been identified as essential services. This includes people working in transportation and manufacturing, in grocery stores or other essential businesses. Also included are any symptomatic person who lives with a healthcare worker, a first responder, or a worker in congregate settings, such as a correctional facility, shelter, or care or residential facility. I want to encourage any Manitobans with respiratory symptoms who meet our criteria to get tested. Our criteria also includes those who have traveled outside of Manitoba in the last 14 days. Those who have been in close contact with a confirmed case, all healthcare workers who are symptomatic, first responders such as police officers and firefighters, all lab workers who have worked with COVID-19 samples, any individuals who live or work in the north, a remote or isolated community, a group setting such as people living in a correctional facility, shelter, long-term care, or a residential facility, or work in a remote work camp. So our testing capacity has increased, and certainly our capacity is higher than the amount of samples we've been receiving, so we've expanded our criteria and encouraging Manitobans who think they meet these criteria to contact Health Links and to get tested. I want to continue to thank all Manitobans for following public health advice, but again caution that our low numbers should not indicate to you that our risk is lower. The COVID-19 is still in Manitoba. We still see this virus circulating. It's circulating in all health regions at this point. The lower numbers are a reflection of our strict social distancing strategies. And so to continue our progress, we need to continue with those social distancing strategies. This is why the Public Health Act orders have been extended till May 1st. I'm reminding Manitobans that there should be no non-essential personal travel. Manitobans, regardless of where they live, need to adhere to our public health orders, to adhere to social distancing strategies, wash your hands frequently, stay home whenever you can, leave for essentials only. And staying home includes only traveling to the cottage or secondary residence if required. If people must travel, they should only travel with family members. They should not visit others during their time of travel. They should avoid stopping for gas or other supplies on the way, and only visit local health providers in the case of emergency. Encourage Manitobans to continue to access credible information. Manitoba.ca/COVID-19 is an up-to-date website. Can provide you with much information on a regular basis. We're continuing to work on the development of modeling in Manitoba. These models can help us plan and understand what things may come, what numbers we may be able to expect. We can use information from other jurisdictions, including national data, but to be useful modeling, we need to use Manitoba-specific data. And because we are behind, we are at different aspects of our outbreak compared to many jurisdictions, our data, our numbers have been quite low. So it's difficult to come up with useful models with that type of those type of numbers. So we continue to work on it. We're going to try to share some of that information as we get more and more useful models to present. But again, the biggest reason why we haven't released that is because we are, 6 weeks behind other jurisdictions in the outbreak trajectory. So again, I want to thank all Manitobans for your work to help flatten our curve. And special thanks to our healthcare workers on the front line for all your dedication and hard work. Together, we're going to continue to use our social distancing strategies. We are going to be looking to the future. We will be dealing with this virus in one form or another for the foreseeable future. But the plans are not to have to deal with it with these strict measures for much longer. But we need to react cautiously optimistic, but we'll need to continue our social distancing strategies for the near future, and we'll keep Manitobans posted on any developments. So thanks, and I'll pass it over to Lanette.
Thank you. I'm Lanette Siragusa from Shared Health, and I wanted to begin today by thanking two microbiologists from the University of Manitoba who have been spearheading efforts to gather and donate PPE for healthcare workers. Their names are Eliza Gertstein and Jason Kindrachuk. With the research labs shutting down last month in order to reduce the spread of COVID-19, Eliza and Jason began to solicit research scientists to donate personal protective equipment for healthcare workers. Their response was tremendous, with donated supplies quickly taking over their respective workspaces. Dozens upon dozens of boxes containing gloves and masks have been collected to date, as well as several N95 respirators, safety glasses, face shields, protective gowns, and disinfectants. Even after dropping off all these supplies at one of our collection depots, Eliza and Jason continue to encourage their colleagues and organizations to step forward and help out. So I want to thank them both and all the researchers who have donated their supplies for going above and beyond to support healthcare workers. It is greatly appreciated. And I just wanted to give you an update on personal protective equipment. We continue to take every available and appropriate step to protect our healthcare workers from exposure to COVID-19 so that they are able to take care of the sick and vulnerable Manitobans over the coming weeks and months. These steps have included enhanced screening upon entry to any healthcare facilities, visitor restrictions, postponing non-essential services, encouraging virtual options, and we are now looking to limit the number of staff working within personal care homes so we can reduce the risk of exposure for our senior citizens. Because we are weeks behind other jurisdictions in the spread of this virus, we have also been fortunate to have the opportunity to learn from them, and they have been very generous with sharing their information and protocols with us. So this has learning from others and partnering with other jurisdictions has also, I think, helped contribute to the lower spread of the virus that is being experienced elsewhere, along with the tremendous efforts of all Manitobans to follow the public health orders and respect the physical distancing. So I also want to thank everyone for their contributions in that regard. But the current success does not guarantee future success, and we must prepare now for any potential surges or outbreaks that may occur in the future. Supply levels and demand continues to be a challenge and changes day by day, depending on the area of need and the timing of deliveries. We are taking every possible step to ensure appropriate protection remains available to staff in high-risk situations and settings for the duration of this pandemic, no matter how long it's going to last. And appropriate use now will conserve supplies that we will need later. So as a result, experts in infection prevention and control, staff health, as well as public health, have all worked together to identify the supplies we must have available to protect workers in critical and priority services. We will be sharing these new guidelines with regions, facilities, and staff later today. And this approach includes consideration of the highest risk and highest need to ensure that staff are provided with the appropriate levels of protection for the setting in which they work and the situations in which they may be exposed to. Similar to other jurisdictions, we have now categorized setting and situations in zones depending on risk. So these are, we have a red zone, which is where confirmed COVID-19 positive patients will be. Those who have tested positive and confirmed to have the virus will be in the red zone. We have orange zone, which is suspected COVID-19 patients, which include those who meet criteria for screening, have been tested, and are awaiting results. And then we have a green zone, which are non-suspects for COVID-19. Our experts have identified the level of PPE required for each of these zones based on the level of risk to the staff and the level of risk to the population we are caring for. We have considered areas where screening may not be possible, like the emergency response services or the emergency departments or emergency rooms, where sometimes a patient's medical history may not be known or available, or where a quick response may be required. And we continue to emphasize the importance of strict hand hygiene to conserve gloves, as well as disinfection and reuse of eye protection. We are also encouraging the use of cloth gowns instead of disposable gowns. And to further conserve PPE for healthcare workers, we are recommending all people who enter a healthcare facility to wear a cloth mask. We are encouraging patients and clients to wear non-medical face masks during any healthcare interaction, as well as when using public transit, handy transit, or a taxi. These are not easy decisions to make or to implement. They are vital, though, to ensuring protection of patients and staff in long-term care and in hospitals. This is part of our efforts to do everything possible to make sure Manitoba has the supplies our staff need when they need them. We are buying what we can, when we can, while always ensuring our supplies are safe and appropriate for use. We are preserving our supply by safely extending our use of PPE when it is safe, and by sterilizing and reusing equipment that can be used again. And if there are supplies that we can make closer to home, we are working to create made in Manitoba solutions. So we continue to work through the PPE. I feel like the more that we keep going, the more that we learn about this virus, the more that we learn from other jurisdictions. Our plan keeps evolving and getting better and more refined. And we will continue to keep adapting to this virus, to the spread, and we will stay in it together. So with that, I will open it up to questions.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Question for Ms. Siragusa. With respect to those different levels of risk that we now have in place, the red, orange, and green, can you give us some examples of what a healthcare provider would wear in each of those settings as far as PPE?
So in the red zone would be like a critical care, for example, or a medicine unit where we know that there are positive COVID patients there. So they would require the whole PPE, like we are talking masks, visors, gowns, so that they are fully protected and of course, because they have the highest risk patients there in terms of spreading COVID. But as you work through different levels, like a green level might be a unit in a hospital where people just are not positive for it, they're not symptomatic of it, they have no travel history, they have no contact history. So going back to our typical protection wear, that we would still wear gloves, of course, if you're dealing with blood or bodily fluids, and you may wear a mask as well, but you wouldn't necessarily have to have the whole head-to-toe cover because you're not dealing with COVID positive patients and the spread. So, of course, there's other infectious diseases out there like MRSA and things, so those would have to be considered and taken into account.
Thank you. And then a follow-up for Dr. Roussin. We've seen an outbreak in packing plant in Alberta of COVID-19, of course. What kind of policies are in place in Manitoba to make sure assembly lines, things like processors and other services that are deemed essential are there to protect employees? For example, are they getting temperature tested, or are we kind of relying on the honor system as far as social distancing goes?
Yeah, so public health has been working with various sectors, including the ones you mentioned there. So yes, employees are getting screened and a lot of information provided. So there is a lot of information out there, screening going on just to protect the employees, to ensure no one's coming up going to work while ill.
From the Winnipeg Sun, Scott.
It's Scott Billick, Winnipeg Sun here. First question for Lanette. Obviously, risk with keeping a lot of people or a lot of staff in personal care homes, but what is the risk of reducing staff in personal care homes given the needs of folks who live in those?
I'm sorry, I didn't quite hear the question. Are you asking about a reduced need in personal care homes, a reduced need for staffing?
No, sir. So you mentioned reduced staffing or looking at reduced staffing in personal care homes, I believe, earlier on in your comments. And just wondering what the risk is of having less staff in homes where, the care is a kind of a 24/7 thing. Right.
Yeah. So I'm glad you asked that question because I definitely want to clarify that. We're not looking at less staff in personal care homes. We're looking at less movement of staff between different personal care homes. So right now there are staff who have multiple personal care homes that they go to, and what we're looking at is that we can support them to work in one instead of working in many, so that if there's any exposure to the virus, that it's minimized as much as possible and contained. So we absolutely want to maintain this baseline, the current baseline of personal care home staffing. It is not our intent to decrease that at all. It'll just be a matter of working with the facilities and the staff to determine how best we can make that change.
Okay, thanks. And then my follow-up is for Dr. Roussin. Brian Pallister talked yesterday, and you were in that at that press conference. He wants to be the first province to kind of reboot the economy and stuff like that. How much pressure does that put on you as the guy that makes the rules and that sort of thing? And do you feel pressure, or at the end of the day, do you feel it's up to you when it comes to when I guess things get reopened and stuff like that?
Yeah, so we have a number of indicators in public health and healthcare setting that will guide that kind of work. So certainly we realize that there's more to health than just this virus. So the impact of these public health orders are affecting Manitobans. So we want to leave them into for the shortest period of time as we need and to the degree that we need. And so, in that respect, we want to ensure that we're going to restart things cautiously. But it's certainly necessary to be looking at those things because, a lot of Manitobans have been affected by this. So we want to ensure that our public health indicators are met. But once they are, we're going to look to be able to cautiously restart our economy and monitor the situation really closely.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin, it's Mohammed from Radio Canada. I was wondering, are you considering to make it mandatory in Manitoba to wear masks in public transport like other regions in the world do?
Yeah, so masks in public, that's been an emerging issue over time. And so certainly the non-medical masks, people can consider using that in public. It's an additional way to protect people around you. Certainly the most important thing are the social distancing strategies, the washing the hands, staying home when you're ill. But that cloth mask, although it doesn't protect the person wearing them, might provide some added protection for the people around them. So I think the messaging is important. Right now, it's not something that we were looking at as far as mandatory as far as our public health order goes, but as things develop, we're always reviewing what other jurisdictions are doing, reviewing what's going to work best for Manitobans.
Thank you very much, and I have no follow-up this time.
From CBC Manitoba, Bart.
Dr. Roussin, Siragusa, we understand 2 orders have been issued to bring back care of COVID-19 patients into hospital care. What's been the result of consultations between the province and you folks on who restrains the patients believed to have COVID if they're trying to leave the hospitals?
Okay, yeah, I guess you're referring to the public health orders on there. So yeah, the Public Health Act allows for a communicable disease order for anyone who has or may have a virulent condition, and the order is necessary to protect the health of the public. So I won't speak to the exact nature of each of the cases, but if somebody was thought to have COVID-19 and was making it clear that they would not self-isolate, then we could issue that communicable disease order in the Public Health Act to require them to self-isolate until such time as a medical officer of health felt they were no longer a threat to the public. And so that's the nature of those orders.
An entirely different question. How's the province doing for hand sanitizer for hospitals? We're trying to get a sense of how difficult it is to source it at a large scale. I know the Mint's producing some. What links are you going to try to source hand sanitizer?
Well, I know they've been working with different vendors to get it in. I can get a status update for you, Bartley. I didn't ask that question specifically at our logistics meeting, but I haven't been notified that there's any critical shortage, but I can find out some more details and let you know.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Siragusa, you were mentioning earlier about, we're weeks behind other jurisdictions. We continue to see these low numbers. Are you fairly confident that people are going to continue to obey the suggestions, the guidelines for social distancing and that sort of thing among the general public as we approach the warmer weather?
So, well, I think that, Manitobans know it's their actions that's got us here. So we can look around us in various jurisdictions and see numbers still climbing in certain jurisdictions, and I think it's been Manitoba's efforts at physical distancing that's kept our numbers relatively low. Certainly, again, the same line, cautiously optimistic, because we know the virus is still here, so that it can still spread in our community if we're not careful. But I think Manitobans know how important this is. The orders are still in place for that reason to ensure Manitobans are going to be compliant with this. And so we're going to keep watching the situation and following those numbers quite closely.
And a follow-up question on the supply issue. Some of the PPE notices we get mention there's an urgent need. And I'm just wondering if you can put that into context about how urgent it is. Sometimes we see things like gloves or gowns pop up that might not have been there previously. So how are we doing in terms of gloves, gowns, and other PPE measures? Do we have enough to last for a few months?
Yeah, so what we've been really, since we've been challenged with getting our orders in and having them shipped in the volume of which we've ordered them, we have been really looking at every 2 weeks. Can we get the supplies out to the regions, to the staff? Can we look at a more centralized approach to it? Because we are very fearful that there's theft and potentially hoarding that we've heard of. So working really closely with the regions to make sure the orders are delivered and distributed to the staff, and that there's good control over that PPE, because it's very valuable for everyone. So we're looking really, we do have a long-term vision, of course, to build up the supply and make sure we conserve and make sure we use appropriately. So going into the next 2 weeks, it looks like everything is in good shape. We have no big red flags at this point, and there's more orders constantly coming and to be delivered. So if there's any interruptions, then we would flag that. But right now, for the next couple of weeks, we're in good shape.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. I'm wondering if have you sort of long-term planning in the eventuality that a vaccine takes longer than what you're expecting? Yeah.
So yes, so working at the Special Advisory Committee, the Council of Chief Medical Officers of Health, and PHAC, are working on strategies. We know that we're going to be dealing with this virus for the foreseeable future. What that's going to look like is we're still learning. We sure could expect multiple waves of this virus is something that we're looking at, or at least needing to manage the virus in some shape or form until there can be a pharmaceutical intervention similar to to a vaccine. And so yes, so we have phased approaches and looking how that might look in each jurisdiction, because we know we can't have the measures as stringent as they are right now. We can't maintain this for long periods of time, so we have to find ways to deal with the virus otherwise. So we are working on that in the short, medium, and long term, and a lot of it's will rely on eventually getting a pharmaceutical intervention.
Okay, and then in regards to getting more data for the model, how much longer will we go before we open up testing to all symptomatic people? Wouldn't that be the best way to get data for a model?
It's going to depend on the demand right now. So we're just a few days since we've opened up the testing criteria again, and so we're going to look at the demand. If the demand remains low, then again we're going to start expanding. And so we want to ensure that we're utilizing our capacity right now appropriately. We have relatively low numbers, relatively low positive test proportion. So we want to be able to ensure we can ramp up our testing when we need to. But right now, with such low positivity rates, we want to ensure we are using our capacity efficiently.
From City News, Stephanie.
Dr. Roussin, Stephanie Luciuk with City News. I know it's a difficult question to answer, but how long will we have to see numbers like we're seeing with more recoveries and active cases before we start loosening up restrictions? Yeah,
so certainly the plans are in place right now to look at how that might look. to loosen some of these restrictions. The length of time depends on a number of things. It depends on the number of cases, certainly. It depends on the nature of those cases, whether we're seeing a lot of those even low numbers, whether they're community-based transmission or whether they're entirely linked to known cases or to travel. So there's a number of those. We look also at the positive test proportion of our testing regime. And in addition to that, there's a number of health sector things we need to look at, right? Personal protective equipment, hospital capacity, making sure we have measures in place protecting our PCHs as well as other at-risk communities such as shelters, congregate settings, and as well as the north. So these are all sort of the factors that we're looking at, and once we have a green light in all of those, then we can look to cautiously start reopening things.
Okay, but even if we do see numbers like we are seeing, I guess how many weeks we have to see the current numbers that we're seeing or the trend that we're seeing, I guess, for us to start taking those first steps?
Yeah, well, with numbers like this, we're certainly approaching an R value here of around 1. It's hard to know exactly where it is, but we're sure not seeing propagation of the virus right now. And so, ideally, we would look at least one incubation period, which is 14 days, and possibly up to 18 days or so of these numbers to tell us that we're in a stable environment.
From the Winnipeg Free Press, Danielle.
Good afternoon. Danielle De Silva from the Winnipeg Free Press. Dr. Roussin, your counterparts in at least 6 other provinces believe residents should have information on COVID-19 projections in their communities, including Saskatchewan, which has released its projections and has similar case numbers to Manitoba. If this information can help people prepare for the impact of COVID-19, why are Manitobans not being given the same respect?
Yeah, it's mostly what we discussed. So we want to be able to provide actual modeling numbers with Manitoba data. Certainly, you can just extrapolate from different jurisdictions and divide by population numbers. That doesn't really tell you a lot. And so those type of calculations don't really predict what we're going to see. So models are best made with Manitoba data, and they're best made with when you have enough data, and then they're going to properly inform Manitobans. So just to do a calculation based on another jurisdiction and divide by our population doesn't really tell you much, and it doesn't provide information to our healthcare system. So we're going to try to do it with Manitoba data. We're going to try to do it with some good modeling numbers to try to inform our actions, but we also want to share that with Manitobans.
Thank you. And just as a follow-up, so given that we need some more data, what is the minimum number of COVID-19 cases required to produce reliable data projection that you would be confident sharing with the public?
Yeah, so we have mathematical modelers working on this and epidemiologists and a team working on it right now. So I don't think there necessarily is a specific number that I could quote here. It's based on the number, the time of that. So even with these numbers, they're working on the models. They're trying to get useful ones that we can share with Manitobans. So they're working on it certainly right now and have been for some time. But I don't have a number that I could quote that would trigger definitely a good model.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, it's been some time now since we've introduced tougher enforcement with fines for not following the public health order, and we are heading into some nicer weather here shortly. Are you able to speak about if you've heard of many fines being handed out, or if it's mostly warnings, if you have any numbers on that, or is it something that you will be able to provide updates on moving forward?
Yeah, certainly we're going to try to provide updates as the need arise on that. I'm not aware of any fines being issued. There have been some of the health hazard orders issued on the tattoo parlors. There's been numerous warnings given by the community ambassadors And so, I think that for the most part, Manitobans know the importance of this, and it's bared out in our numbers. But we, enforcement going forward, like you say, nicer weather, we're going to have to stay on top of it, ensure that we're not loosening things up too soon to reverse all the progress we made here. And so, but yeah, we'll keep up to date if there's any fines that we can report on.
Thank you. And my follow-up is Ontario says community spread has peaked. It was originally set to peak in early May, but because of good physical distancing, that came sooner. Although we don't have modeling ready to be released in Manitoba just yet, do you think that's a similar situation in Manitoba if we continue to see these low numbers? And are you able to say if we are approaching our peak here in the province?
Yeah, so it's certainly the numbers are reassuring right now, but again, we have to be cautious. We're still seeing the virus, meaning that the virus can still be spread in our community. So it's definitely a reflection of Manitobans' hard work at community at social distancing. It's difficult to say whether we have peaked or not. If we look at, say, Ontario finding a peak now, which was a bit earlier than some of their models suggested, we're still 6 weeks behind in our trajectory, and so it's a difficult thing to comment in real time. The peak is usually we can usually tell as we've passed it. So it's certainly important to continue our social distancing strategies. We have a flat curve right now, but that could change if Manitobans change their behavior.
From the Brandon Sun, Bud.
Hello, Bud Robertson, Brandon's son. For Lanette, regarding the zones, it sounds to me like green zones would encompass generally places such as long-term care and palliative care. I'm wondering, will these zones then affect the changing the requirements, the PPE requirements in these areas from what they are now?
Yeah, it would, I think, Bud, because right now, as we had early spread early on and our numbers were going up quite significantly, we had a lot of PPE in a lot of places just in the just to be precautious and or be prepared for the situation. So now that we do have that flat curve and we are getting more experience and our testing numbers have gone up, what we want to be able to do is make sure that we have full PPE available for those high-risk situations in those high-risk environments where we either know COVID is there or we think there's a high, even a small possibility if someone has symptoms or a history of contact or travel. We want to make sure those precautions are available and in place for the staff and for the patients. But for those others that have not traveled, who are low risk, who, I can give an example of someone who is just walking down the street and broke their ankle and comes in for surgery. There's no reason to think they are COVID positive, and a screening would still be done regardless. But if there's no COVID, then we can start to go back to more what we always do in healthcare for patients and for protecting people. So we would still have the masks and the gloves when required. Of course, the gloves and the gowns, whatever needed normally is still going to be available, but it's not going to be because there's a fear everywhere. It's more, we're learning, we're becoming more confident, we are screening people, we're testing people, we've got our public health processes very well defined, and so we're going to carry on this way for now.
Thanks. And just a last quick follow-up. Do these zones take effect immediately or just coming forward?
I think first we need to make sure everybody's informed on them and make sure that everything is already available, but make sure that there's information and education, and then as soon as possible we will have those guidelines out.
From the Flin Flon Reminder, Cassidy.
Hi, this is Cassidy from the Flin Flon Reminder. We're still just wondering exactly how enforcement will be of the northern travel ban. Who will be doing the enforcement? Is there going to be screening at airports or rail stations? What exactly is that going to look like?
Right. So the enforcement measures are still being sorted out for that. Those are some of the things you mentioned are options that could possibly be in place. Certainly, check stops might be in place at some point. So for the most part, these public health orders have gone out, and Manitobans have come through and followed them. And so you can see we have a number of public health orders in now for over a couple weeks, and we haven't issued any fines, but our numbers have maintained a good course, and so it's really that Manitobans follow orders set out. They follow public health advice, so that's the main focus of it. If need be, we sure have a number of options to enforce things.
And I guess as a follow-up, you implied that the northern ban is part of the steps to loosening restrictions. If you were to loosen restrictions and the travel ban remained in place, would there be a loosening of restrictions above and below the parallel, or just one?
Yeah, it's a good question. So we haven't had everything sorted out. We know that given this trajectory, if the numbers stay at this, we can certainly look to start loosening some of the restrictions, and I think it's necessary. I think it's what we want to be able to loosen them, certainly cautiously, and so we'll have to part of that is to ensure that as we loosen it up, we're not putting people at increased risk who are already at the high risk. So certainly remote isolated communities we need to protect. PCHs need to protect. So we'll look at that. Certainly the travel restriction will very likely remain in place in some shape or form as we start to loosen things, because we need to have that added protection for those communities.
Thank you. We have some limited time left. If any reporters have further questions, please proceed.
Hi, Barbecue this here at CBC. Dr. Roussin, can you confirm you've had a lot of turnover in your modeling team and that you are happy so far with the quality of the data you've been getting?
No, I don't think there's been any turnover in the modeling team that I'm aware of. I've been seeing some really good work, but it's just with modeling, it's you don't run at one time. It's hundreds and hundreds of variations and inputs into there to see. And so when we have low numbers like this, what we see is it's inevitable to see a high variation of the projections because we have such low numbers. So we're looking to be able to tie that into the to the capacity healthcare system to be able to show what that means to Manitobans as far as our capacity in the healthcare system is. We want to be able to tighten up some of the variability there so that we have a bit more meaningful numbers. So that's been all being worked on by our modelers, and we hope to have some numbers that we can share relatively soon.
Hello. Oh. You waiting on me?
Yes.
Yes, it's Bob Robertson. Dr. Ruth, can you give me some idea of, on average, how long people are staying in the ICU before the discharge, and in fact, have any actually been discharged from ICU with the COVID?
There has been people discharged. I know I have an average length of stay somewhere with on here. I'm not sure if I have that on here. Yeah, sorry, I don't know if I have that with me here. Sort of that average length of stay. We can get that to you next time.
All right, thank you.
I got a question just regarding the reopening of different businesses and stuff like that, will that also depend on a consistent supply of PPEs, like not maybe looking at 2 weeks, but maybe looking longer term, making sure there's enough just in case?
Well, it's certainly that's one of the public health indicators, or the indicators that we need to achieve before we look to open things up. So it's we have to have an adequate trend in our numbers. We have to have adequate capacity in the healthcare system, which includes the ability to ramp up PPE. We have to have the ability to ramp up the need to deal with cases and their contacts. So there's a number of factors that we're all looking at, and until those are met sufficiently, we're not going to be rolling back our restrictions.
Dr. Roussin, what exactly does happen when a COVID-19 confirmed patient refuses to stay away from the public?
So it depends. In the instances where we've issued orders on this time, the client complied with the orders, so no further action had to occur. So in the two orders that I'm familiar with, they were Section 43 communicable disease orders, and it was somebody who was high risk for having COVID-19. The test result was not back. They indicated that they were going to leave hospital and not self-isolate. So it was the decision of the medical officer of health to issue the communicable disease order, and those people complied until the result was back, and then both times it was negative, and then they left.
Great, thank you.
Dr. Roussin, this has been from the Free Press. The projections and modeling for the province has been shared with the government. Just wondering why that information cannot also be shared with the public if it has been presented to the Premier and the Health Minister.
Yeah, so there's been multiple variations of the modeling that we're working on. So really a final model hasn't been presented. We're still working on those models. So they change over time. We input new data into them. So you don't really have a final model that's been presented to me or to anyone. We're still working on it. And then once we have that, we're going to have to, we want to be able to put it in a presentable form that will be useful to Manitobans to see. And so we're working on that right now. But given our current numbers, the variability of the projected numbers is going to be very high. So it's hard to make get a lot of meaning from it.
Thank you.
Scott Bill here with the Sun. Again, I'm asking a question. But a couple of people ask, people who drive in from, maybe outside of the province to come in, pick somebody up at the airport, and then to drive back. Is that allowed? Are people allowed to do that, or is it recommended against? And just based on the centralized area of the Winnipeg airport and how people come in from just on the outskirts of Manitoba, outside of the borders.
So the public health order that would apply to this is the requirement for 14-day isolation for interprovincial travel, and so there are some exceptions for routine travel from those in nearby communities on the border for necessary trips. So there's some interpretation there, but for the most part, people should be staying home. We shouldn't be leaving Manitoba, but those in nearby communities making essential trips is allowable.
Thank you. And this concludes today's media briefing.
Thank you.